Africa has this incredible asset of its youth, and that will make it the most interesting continent throughout this century. How much that youth can really drive progress will depend on the investment decisions we make in the next 20 years, in their health and their education. And so if we prioritize that, boy, there's an unbelievable future here.
Goalkeepers by the Gates Foundation comes to Lagos for the first time ever, beaming the spotlight on African changemakers driving real impact and accelerating the achievement of sustainable development goals on the African continent. Hello and welcome to this highlight as the Gates Foundation annual event celebrates the brilliant, resilient and leadership rising across Africa. I'm David Alabi. A high-level panel conversation with the founder of the Gates Foundation, Bill Gates, and the governor of Gombe State paint a clearer picture of how much work lies ahead in advancing healthcare delivery to the last mile. Statistics,
as it is today, coverage of immunization is around 50%, and access, that is, to primary health care has also increased because now we have about 45%. And besides that, we equally have all the infrastructure needed around the health sector.
And a decline in maternal and
oh yes,
mortality,
obviously, because it's not only the resultant effect is not only in just attendance, but child mortality, maternal and child care has improved, and also mortality has reduced. And also the impact of the operations of the primary healthcare centers has reduced, absenteeism, and the staff are well motivated and they're doing much better than we wanted them to do.
But I'm sure, a round of applause for the governor, please, for everything that they've achieved in Gombe State. But I'm sure there were challenges along the way, which we'll address in just a moment. But Bill, let me come to you now. You've announced a landmark commitment, pledging to spend $200 billion over the next 2 decades, with a large portion of that focused on the African continent. That deserves a round of applause, I think. Because this is happening at a time when there's a great deal of concern about the declining levels of foreign aid, right? Especially to the African continent. So, Bill, I think we all want to know what inspired you to do that, and how will the foundation ensure that this investment strengthens local institutions and avoids dependency, that it's not charity?
Well, the Gates Foundation got started in the year 2000, and the basic guiding principle was that all lives have equal value. And so I was curious to understand, why do children die? What do they die of? Where do they die? And it was pretty stunning to find out that the chance of a child dying in northern Nigeria is 50 times greater than in a rich country. It's one of the for a place without war, it's one of the worst places in terms of child survival and maternal survival. And so I looked and I said, okay, are people taking this seriously? Are they making the medicines cheaper? Or are they tailoring the medicines to the particular needs of those areas? For example, investing in new malaria tools. And the answer was no. And so that became the guiding light for the Gates Foundation. Over 70% of what we've spent, the $100 billion we've spent in these last 25 years, went to global health. And throughout that 25 years, we've developed deep partnerships throughout Africa, here in Nigeria. And we've had amazing partners who understand the delivery, the way that we can work and help government. Government in the long run has the responsibility for all of this work. We're there to accelerate these systems. It's very exciting that if you improve health, it actually accelerates the economic growth of a country. And eventually, we've seen with Asian countries that invest in health. They grow their economy, and eventually they get to this middle income status, and they're able to be basically self-sufficient. These next 20 years, the countries in Africa will get to that status. So helping them accelerate that, helping understand, okay, what are the unique local challenges? Which things do we need to make simpler, bring the price down? That's done as a partnership.
Right.
And the last 25 years went way better than I expected. That is, the childhood death globally and in Africa was cut in more than half. We went from almost 10 million worldwide to now less than 5 million. And I feel confident we can cut that in half again, even though, as you mentioned, right now we're in a stunning and completely unjust withdrawal of support from a number of rich governments, including the United States. But even despite that, which is going to make the next 4 or 5 years, we'll have some reversal because it's just too large and too sudden to overcome. We will get back to incredible progress reducing those
I was going to
deaths.
ask you how big of a reversal and what's the timeline? What timeline do you expect to continue making that progress again?
So the number of children who die every year has gone down faster every year for the last 25 years, over 3 times faster than ever in history. And, and there's some, very key things that were done there. There were new vaccines that were made cheaper, like rotavirus, pneumococcus, penta. And Gavi is a group that helps fund most of those costs to make sure they get to all the world's children. So that alone, the bed nets for malaria, the preventing HIV transmission from mother to child, a little bit of progress on malnutrition, although that will be a big thing in the years ahead. So all that came together, and people started looking at vaccine coverage, and various countries can compare their vaccine coverage. There's some countries in Africa that have over 95% vaccine coverage, better than the United States. There's some countries that only have 50% vaccine coverage. So quite a range that if we spread best practices, we can do.
So there is hope that we can still make progress even if there's a decline in the coming years.
Taking the best ideas from all over Africa and sharing them, that alone would be a gigantic thing.
Right.
The president of Dangote Group, Aliko Dangote, joins the conversation with his take on strategies that will redefine the next successes for Africa, leveraging the private sector.
We can make it happen in business and also in health. We've actually done a lot. Let me start with health. In health, through our own partnership with Bill, we've actually, end polio. And then also we have participated and also did quite a lot in nutrition. So that's, on partnership. But in terms of business, it's true. We have done quite a lot by reversing a lot of things, Nigeria used to be the second largest importer of cement in the world. And now we have reversed it. Nigeria now exports cement more than any other African country. We've looked at also challenge in terms of fertilizer, where our farmers were suffering no fertilizer. We built from the 0 level to the second largest plant of fertilizer in the world. So Nigeria now, not only we actually export 37% of our fertilizer to the United States of America.
Wow.
Again, in terms of petrochemical, Nigeria imports about 350,000 polypropylene. Now we have addressed that issue. It's not going to happen again. We'll export, not only that we'll meet the local demand, we'll export 600,000 out of the country. to serve all the other African countries. Petroleum, Nigeria, we have now capacity. And, we went on and said, okay, fine. What's the highest, biggest capacity of refinery that has ever been built in the world?
Right.
By Saudi Aramco, which is 430,000 barrels. We said that let us do what has never ever been done before. That is to do 650,000 barrels per day. And we have delivered. This month alone, that's May alone, we have actually exported 400,000 metric tons of PMS, which is
Right.
petrol. Nigeria used to import 100%, but right now, no more.
Okay.
So when we have done all these successes in business, there's no way we will not be able now to do this in health. And what we need to do is to make sure that we stop this health tourism. And we should now get into producing our own drugs. We should now make sure that when you are sick, you don't have to travel abroad. All of us, including myself, if we are sick, we shouldn't now. But we need to do partnership with Bill and other
let's
people.
hear from Bill about that. Bill, you heard Alaji's call there, a partnership and solutions that are rooted in local realities. How do you react to what Alaji Aliko Dangote has said there?
Well, we've had an amazing partnership with Aliko across almost everything we do. The polio fight, figuring out how to get the primary health care facilities in very good shape. He and I, even in Niger and Chad, we've worked in the surrounding countries as well. So, it's great to have somebody who knows the country. There are things that are global technologies that will contribute, and you've got to tune them to the particular needs. And, it's a constant learning journey. That's partly why it's so much fun for me.
Changemakers across Africa share their stories of impact, from simple ideas to scalable solutions, bridging gaps in Africa's socio-economic fabric.
In our first year, we conducted 5,000 tests. Today, we have delivered over 50,000 tests at home. We have created jobs and impacted over 200,000 lives through our platform. What began as a simple idea, helping people skip crowded hospitals to get into basic lab testing, has grown into something bigger. We started getting requests from women saying we want to self-test. So at first we said no, but then we thought, why not? That's how we launched HPV self-sampling kits for cervical cancer screening. And later, Lemon, the first self-sampling kit in Nigeria, made by us, assembled here at home. Why call it Lemon? Because in a country where stigma keeps young women from even saying the word STI, now they can walk into pharmacies and simply ask for a lemon. So at Health Tracker, our users, mostly women, were teaching us what was missing, and we listened. Just last year, we piloted Lola AI, a generative AI women's health assistant to support women with information ranging from menstrual period to menopause. Last month, we hosted a national conference gathering over 1,000 policymakers, innovators, medical researchers, community health workers from across Nigeria. At the heart of that conference was the State of Women's Health Report. It was Nigeria's first comprehensive, data-driven assessment of women's health outcomes across the 36 states. That report was a call to action. We cannot talk about economic progress without addressing women's health.
Through my work at Bridges to Prosperity, we're building more than 650 literal bridges and roads across rural Africa, connecting millions of people to schools, markets, clinics, the things that are important to them, and the people that are important to them. And I believe that access is dignity, and infrastructure is justice made visible. And I believe that when we make that investment, it is because you have seen something worth building, right? But let's be clear, a single seed doesn't yield a harvest. What makes the difference is water, is soil, sunlight, and time. And that's the kind of patient commitment we need in Africa. Not a moment, not a movement, not a hiccup, not just applause, but patience. Not just capital, but actual care behind that capital.
So 2030 is, an interesting sort of guideline for, I think, the world. And for us at Food for Education, we're looking at growing our reach from the 530,000 kids today to 3 million children across Kenya and other 2 countries. We're in the process of identifying these countries. We have a long list. Zambia is on that list. Ethiopia is on that list. Nigeria is also on that list. And great countries across the continent that have reached out to us to say, can you support us with our school feeding program? And once, we identify these countries, it's to look at how can we best support, because we want to localize, we want to contextualize our school feeding programs. As a Kenyan, I can't come to Nigeria and say, this is how you run a school feeding program, because I can't cook the meals. I don't even know how to cook fufu really well. I know ugali, right? And so making sure that we're using local talent and using local ingenuity to be able to support the work is really important.
Artificial intelligence and understanding nuances from an African perspective forms the heart of discourse in driving partnerships and investments needed to scale African solutions with integrity and impact.
I'll pick a product that has 2 lifespans. The product actually won Gates Foundation Global Challenge in 2023. Kudos to Gates Foundation. Then it was called DSN AI Innovation, now Equalize AI. And it was about building AI solution that can generate learning content in local languages. And this is to make science more appealing and interesting to young people in their local languages. Imagine photosynthesis, osmosis, metamorphic rock, explain with relatable images that young people see every day. Just imagine how it stirs their interest and curiosity to want to learn about STEM. So we developed this solution, we deploy it in school, and the excitement of the learner learning science in their local language is amazing because it's what they see every day. But the other part of the product, which is more, which is also interesting, was 2021 when we first built it. It was built as an SMS interactive learning platform. And it was done during COVID because the learners we were targeting and that used the platform were 8 million learners, no internet at home, no laptops, no smartphones, they only had feature phones. So we converted learning into short messaging system. I'm sure we all know SMS. So we used AI at that time to simplify learning into short bites, and then we turn it into dynamic quizzes. So as you learn, you have a quiz. If you get it, you get a more difficult question. We call it adaptive and interactive learning. Now, 2 things for me here. While we use the power of LLM through the support of Gates Foundation, we also understand localization through the context of the user.
I'm also encouraged by young Africans like myself. I have friends across Africa, young change makers, innovating across edtech, fintech, govtech, waste management, and this gives me joy. For it to scale with integrity and impact, I think it needs to be more inclusive. We need to be more inclusive. Also, we need to embrace ethical practices. And another thing I think we also need to do is support more young change makers to do the work.
A sit-down with the Africa Director for the Gates Foundation unpacks what's next in accelerating the vision for Goalkeepers initiatives.
The goalkeeper event that we did today in Lagos, which was, I think, one of the tools that we use to actually communicate the Gates Foundation and our partners and all our goalkeepers across the continent in terms of really driving, impact and progress for the Sustainable Development Goals. As you know, the Gates Foundation is one of the partner to a number of African governments across the continent. We do have 5 offices in Africa. the biggest one being in Ethiopia, Nigeria, but also South Africa, Kenya, and Senegal. And we do, work in health, agriculture, financial inclusion, digital public infrastructure across the continent. And our goal is actually to work very closely with the government and other partners to really accelerate progress, specifically around 3 goals. Number 1 is really decreasing maternal mortality, under 5 mortality. And the second one being really to work very, closely with other partners to drive down the impact of infectious diseases like malaria, tuberculosis, polio, and other preventable diseases. And then the third one is really to work to empower as many families as possible and then lift them out of poverty using tools like agriculture productivity and also digital public infrastructure that really connect smallholder farmers to market so that they can thrive.
A musical rendition by music artist Emma Abaga Waje draw inspiration from the very essence of Africa in motion, a celebration of the continent's resilience despite all odds.
I'm so inspired. I'm so inspired. I'm so inspired. Hey, yeah.
Yo. I'm wishing you money, I'm wishing you money, I'm wishing you health. I pray that you ball, I pray that you ball, I'm wishing you wealth.
Well, the event climaxes with a reaffirmation from the Goalkeepers community to drive in fresh ideas and innovative work as the Gates Foundation reimagines a better future for all by 2030. Well, this brings us to the end of this highlight on the first ever Goalkeepers event in Lagos. Many thanks for watching.